One of the most fascinating medical mysteries started with this person being arrested, losing their job. You have a patient, middle-aged, gets pulled over for a DUI. Patient states they've never been drinking. Their blood alcohol level, let's just say in this instance, is over 0.3. So the police have to take them to the emergency room because that could be lethal. The emergency room physician says, you're clearly lying. You've obviously been drinking. There's no other way your blood alcohol level is this high. But the patient is adamant. No, I haven't been drinking. I swear I don't drink. The ER physician brushes them off, probably with good cause, because that's a common story. It's a story I've heard many times. It happens again. The patient gets arrested for another DUI, and now it's painting a clear picture. This patient's an alcoholic. But they've seriously never been drinking. However, because of the second DUI, they get fired. Not just this patient, but other patients with this similar condition start to go, what's going on? Why is this happening to me? So this patient, like others with this suspected condition, was admitted to the hospital where they did a carbohydrate test, and then they checked the patient's blood alcohol level. And sure enough, with confinement in the hospital and observation, the patient's blood alcohol level increased spontaneously. So you might be asking, how is that possible? Well, so are the doctors. It turns out this patient had something called brewery syndrome. Brewery syndrome is essentially where you have certain bacteria or yeast in your gut biome that are overproducing. It starts fermenting those carbs and those sugars into alcohol. And you absorb that alcohol from your gut into your bloodstream, just like you had been drinking, except you hadn't been drinking. You had just been eating. This is a very rare condition, and it has happened to several other people. A lot of their stories are the same. They don't find out until they get a DUI or something crazy, or they lose their job for being intoxicated. They've never drank before. And it's something I didn't even know about until I watched his TikTok video. And I had to look it up and research it. And it turns out he had taken an antibiotic regimen for a surgery previously. And after that, antibiotics can kind of mess up the gut biome. And it allowed that certain bacteria to thrive in his gut. In many instances, once you've been diagnosed with brewery syndrome, the treatment's actually pretty standard. You just have to take some antibiotics or take something to kill that bacteria that's being overproduced in your gut biome, and then restore it with some healthy gut biome.